The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Sara Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, originally intended for presentation at the 2017 Undergraduate Summit, Ensuring Valuable Global Experiences for Undergraduates. Today's webinar will be 1 hour in length, starting with a short introduction of our presenters, followed by the 3 presentations, allowing time after each presentation for 1 to 2 questions, and leaving time at the end to address the remaining questions. This webinar is part of the 2017 ASPPH Presents monthly series and has been approved for 1 hour of CPH continuing education credit. This webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of each presentation and then again at the end of the entire presentation as noted previously. We are pleased to have with us today our speakers, Caryl Waggett, Jolynn Gardner, Sara Dumont, and Myriam Torres. Dr. Caryl Waggett developed the Global Health Studies program at Allegheny College that offers both a major and minor in 2012. She has been a leader in professional development for faculty working with undergraduates in global public health and has led workshops in collaboration with numerous organizations, including the National Institute of Medicine, CDC, AAC&U, ASPPH, and others. She has worked in South Africa, India, Moldova, Tanzania, and Egypt, and has helped to develop international internships and expand the programming around domestic global health efforts, focusing on issues of local concern, including refugee health and on the built environment and human health. Our second presentation will be given by both Jolynn Gardner and Sara Dumont. Dr. Jolynn Gardner is the director of American University's Public Health Program. She earned a doctorate in Community Health Education and Health Services Administration from The Ohio State University, and she is certified as a health education specialist. Jolynn's academic and research interests include undergraduate public health education, issues associated with stress, change and loss, particularly among young adults, drug abuse education and prevention, and healthy nutrition and lifestyle initiatives. Dr. Gardner recently authored a textbook for college-level stress management courses titled From Stress to Strength, Increasing Optimism, Gratitude, and Resiliency. Dr. Sara Dumont directs study abroad at American University, where approximately 70% of AU students now choose to study abroad from more than 120 program offerings. She also established the Abroad at AU program, enrolling more than 100 international students to study at AU for a semester or a year. Previously, Dr. Dumont was Director of Study Abroad at Towson University, Associate Director of Study Abroad at Duke University, and Assistant Director of Undergraduate Admissions at Yale. Our third presentation will be given by Dr. Myriam Torres, who is the Director of the Consortium for Latino Immigration Studies and a Clinical Associate Professor in the Department of Epidemiology and Biostatistics at the Arnold School of Public Health at the University of South Carolina. She completed a postdoctoral research fellowship at the South Carolina Rural Health Research Center in the Arnold School of Public Health's Department of Health Policy Services and Management. Dr. Torres' research interests include health issues among Latinos living in the U.S. and factors related to migration from Latin American countries. She is currently analyzing data of a study exploring the experiences of Latinos during the 2015 floods in South Carolina. Thank you all for being here today. I'm very much looking forward to your presentations, and I'm going to turn it over to our first speaker, Dr. Caryl Waggett.
Thank you, Sara. It's such a warm welcome, and I'm really delighted to be here today. The ASPPH has been a real leader in helping to bring together folks that are trying to work with undergraduates, and so this is a real pleasure. I'd like to start by highlighting some data that the ASPPH has brought to bear for looking at the growth of undergraduate degrees in global and public health. Starting in 2003, we see that there's a call from the Institute of Medicine to encourage all schools, all undergraduates to have the opportunity to study public health. And at this time, we started to see a rise not just in undergraduate coursework, classes being offered that cover global health, but also majors and minors. And this graph shows the number of majors graduating with actual degrees in some area of public health. And we see that the numbers rose fairly dramatically during this time. So from 2003 to 2014, when the data were being gathered, we see that almost an exponential J-shaped curve. Not surprisingly, the growth of experiential learning opportunities, ELOs, have also risen during that time, both the demand and the supply to meet that demand. The range of experiential learning opportunities have a wide variation of duration, ranging from just a couple of days involvement to full course immersion during the course of a semester to a full year or more. We've seen locations vary from, of course, local, where people are working and interacting with folks in their communities, or working and partnering overseas, where they may have community partners through a course, to full international experiences for students. The range of involvement for faculty and the intensity of workload varies dramatically as well during that time also. Not surprisingly, the oversight of the student work varies as well. So students may have high level of oversight from faculty or staff when they're in a program that's part of a course, but very little oversight when they've identified programming that is on their own time. They've gone off and found a third-party provider that offers a program that's really exciting, but they haven't had the opportunity to engage with their academic home institution because there's no need. It's a privately paid for opportunity. All right, so we want to ask what the expectations are of these experiential learning opportunities. So students are looking for certain types of things. They're looking to experience health and healthcare settings other than their own. They want to help people. They want to travel. Sometimes they are looking for a professional edge. They might be looking for resume builders. They want to gain experience. Some of these desires may have problematic outcomes if they're overly ambitious, for example, and looking for programs that may give them hands-on experience where they don't necessarily have prior training. Institutions and programs also are trying to encourage students to go abroad. We see the incredible value of these experiential opportunities in expanding their students' cultural competency. The cultural norms and healthcare settings in different environments can expand the students' worldview dramatically. And we want very much to provide students the opportunity to gain this cultural humility. So academic institutions and programs are looking for these opportunities for their students. And they're looking for those different durations and locations and scales to meet the needs of the students that are trying to do this. Community partners are also looking oftentimes to partner with academic institutions or with students directly. They're looking for respectful engagement. Some of them are excited that they're able to help undergraduate students to improve their understanding of health. Some may be looking for interns to help leverage prestige or investments and resources, and may be looking for specific help in projects or resources in areas where they would not otherwise be able to kind of advance projects that they're trying to work on. And some may be receiving direct outright payment from third-party providers to host students. And so some of these communities or individuals within the communities may be taking advantage of the students in some ways to get resources directly to their community. Okay, moving forward, we see that these differing needs and interests and expectations directly impact the outcome of what we tend to see with students in terms of what they're working with, and the outcomes of the community partners and the outcomes of the institutions. So all these varied programs have the opportunity to not only provide great good, but also some potential challenges. So as we see some potential problems, we see that there may be unethical involvement of students doing clinical work that they are not yet prepared for, or the unethical involvement in partnering with the community in projects that aren't sustainable. They may find that in some instances, students are partnering with an organization that may not be on the up and up and may be paying an awful lot of money to get experiences that aren't appropriate. And that there are some professional programs as they're learning more about and partnering with these professional organizations, are starting to become more savvy in reading applications. And so the opportunities that many students thought they were getting that was going to help them, resume builders, for example, may actually be penalizing them. So for example, you see this little graphic of a woman who's on an internship suturing a head laceration on one of the Vietnamese locals, and hashtag, I don't know what I'm doing, would be very poorly positioned in applying for medical school at many of the medical schools that are savvy to this and looking and trying to be aware of more ethical engagement of students. If it's something, a practice that they would not do in the States, they should not be doing this overseas. So there's an increasing knowledge and understanding of some of these potential challenges of experiential learning opportunities. And there are a lot of strategies that we're trying to undertake to improve these types of programs. I'll highlight very quickly that there are several types of documented student participation during experiential learning opportunities specifically focused on global health. And we have a suite of clinical examples where students are taking patient histories when they don't have extensive knowledge of the language, taking blood pressure measurements, diagnosing illnesses, administering vaccines, suturing, pap smears, delivering babies, and performing lumbar punctures, stuff that is well beyond scale and scope of appropriate roles for students. And for non-clinical settings, we see a lot of our students involved in things that the programs aren't sustainable. They may install hand washing stations that after 2 or 3 years never get hooked up to public water supplies, or bring equipment and resource that require dependency on US or other Western investments in order to manage and maintain them. Students have conducted community health needs assessments with no prior training and developed reports and recommendations based on a different set of cultural norms. So you can see that whether it's a clinical or non-clinical setting, we see students have the opportunity sometimes to go beyond their skill set, and it's a very difficult line. As institutions running programs, it's our goal and obligation to try to develop strategies to reduce the involvement in these kinds of engagements and to find setups that will help our students to have the strength to be able to provide their limitations and live up to their capacity as well. So we have a really interesting suite of recommendations that have come from best practices from institutions that we've worked with and professional organizations that can occur at the program level, like a program in global health, at the institutional level, at colleges, universities, in order to help improve engagement with appropriate programs and to ensure that students are appropriately prepared. And strategies that we can use to impact non-campus related entities, those types of organizations that may be third-party providers that are trying to meet needs of students going overseas and looking to do things. Let me go through a couple of program level efforts to strengthen the experiential learning outcomes. And there's more detail here than I will provide to you. I'm going to try to cover it very quickly, but there's more detail because the webinar is going to be provided back to you and you can go back and look at these slides and get more information. A couple of good strategies is embedding the experiential learning opportunity into the programmatic structure. So students are required to do something. They're academically accountable for those organizations that they partner with or that the institution is partnered with, and they may be provided advanced prep and post-experiential training. This is a really exceptional way to ensure that students are participating in ethically sound programming and need to get programs, if it's not a sponsored program by the institution, that it's been approved by the institution. Numerous groups are starting to develop pledges or oaths to educate students and require ethical engagement in overseas and internship activities. And we, of course, always require and recommend that any programs that you're working with strive for long-term community partnerships that allow for honest and open engagement between all parties. Most importantly, there's increased strategies for assessing these international type experiences, not just looking at student and student outcomes, but also interacting with community partners and institutional and program goals. All right, there are a number of really neat strategies that have been developed, and this is going to be provided in a handout, so I'll just mention that there are specific learning activities that have been developed for cultural competence and pre-departure programming if an institution or a program would like to do so. And I think these are really strong strategies to engage students and help them to reflect and think in advance, and also provide them with the tools for saying no if they don't have the skills or training to do a particular activity. Okay. We also have program level efforts to strengthen the outcomes on the far side when they come back. So there's opportunity for reflection in ways that other folks have been thinking through what to do when the student returns and help them to embed their experience in an academic framework. And this reflection is essential for any really strong experiential learning opportunity. And there are examples, so programs don't have to reinvent the wheel. Right? This is one of the most important parts, but it also doesn't have to start from scratch. All right, we have very specific set of tools that have been compiled that you guys could take advantage of and use if you're looking to help train faculty and partner with other organizations and institutions within your own university. So for example, if you wanted to train all faculty leading experiential term for May term or winter term, some of these examples could be used with the faculty that they could then work with students. All right, I mentioned that there were multiple levels. You can also work at the institutional level to strengthen experiential learning outcomes. And most importantly, based on feedback that we've received from faculty, is that changing the tenure and promotion guidelines to support and value long-term investments that are needed is absolutely essential. So faculty wanting to develop long-term community partnerships may be dinged during their promotion reviews if they are spending too much time in what appears to be unproductive outcomes. If the tenure and promotion guidelines are changed to alter and value productive outcomes to incorporate good community partnerships, that turns out to be one of the most expansive and great initiatives that can be done on a campus. It will help both the faculty working and also the staff working through co-curricular partnerships. That way there's greater interactions between organizations that work on similar topics, but often through different hierarchical reporting lines. So for example, international education and civic engagement and career education guide students towards many of these internship opportunities on a regular basis. And the greater connection between these types of on-campus resources and the academic programs, the stronger the outcome is for all parties involved. Developing standards and guidelines to adhere to ethical and sustainable conduct that the entire university adheres to is really essential. In addition, we need to strengthen the non-campus affiliated programming. There are many nonprofits that are absolute models of working with community partners, and there are a number of organizations that are a little bit more fly-by-night and are striving more to secure student pay fees and work with partners that perhaps may not be as sound in their goals and objectives. For a student, trying to discern which of programs are ethical and which are not, it's an enormous task. So most importantly, we recommend that the campus as a whole work with professional organizations towards accrediting or identifying specific ethical sound guidelines, and partnership or organizations that adhere to this then become recommended for students to use as one of the primary areas. We also recommend that we work to develop guidelines, trainings, and to place pressure upon third-party providers, and many of those organizations, ASPPH is one of them, NAFSA, which is our international education organization, CUGH, which is the Consortium for Universities of Global Health, all are starting to work towards this end goal where we provide information to professional schools, for example, and so they have greater information and are looking for things. So it's an indirect way to pressure some of the less ethical third-party providers to push them out of the market. And of course, striving to institute guidelines are really essential. We want to make sure that we reward most appropriate behavior and penalize inappropriate practices. Finally, assessing. And assessing means not just assessing students, of course, but assessing the institutional goals, the programmatic goals, and the community partners to ensure that everyone's getting their needs met. If we're consistently making an effort in this end, we'll also start to identify and work through those organizations that are having the most success and will have the most successful outcomes for all parties involved. One thing that I can recommend is that talking to colleagues that have best practices that are living up to these steep expectations is one of the most important things you can do to learn how to strengthen your own program. And I'm really excited to hear further about the program that American University has started at Kenya and that the University of South Carolina is working with in Costa Rica. Both of them are models of best practices that utilize many of the tools and skills that we've highlighted here. If you have any questions, I'm very excited to answer questions now. You can contact me at the information here provided and be happy to respond later as well. Many thanks for the opportunity to talk with you today.
Thank you so much, Caryl. This is Sara. I'm actually going to pass it along to Jolynn and Sara now and hold the rest of the questions for the end. But I want to say thank you for setting the stage and turn it over now to the next speaker.
Hi, everyone. We're from American University. I'm Jolynn Gardner.
And I'm Sara Dumont. And thank you so much, Caryl, for really setting the scene for the specific programs now that we'll be talking about, because that was just a fabulous overview of all of the issues that confront us in developing and managing these programs.
So today we'd like to tell you about a program that American University has in Nairobi, Kenya. And let me see if I can advance the slides. Here we go.
Right. So we first established a study abroad program in Nairobi in 2004. It was right after I came to AU. And at the time it was an initiative that came to me from our School of International Service. Most of those students are studying international relations, international development, issues like that, and they wanted to have a program in Nairobi because we had some alumni links there. So we first developed that program in 2004 is when it started, where it was a combination of students taking courses from faculty that we hired on site for them to take, and also other courses at a local university partner, which is the U.S. International University, and we still have a relationship with them. Initially, we only had a few students, and we were doing it on a shoestring, and we didn't have our own space. We were renting classrooms and that kind of stuff. We finally established our own center 2 years later, and the program was very successful. So we began to think that a program in public health would be an ideal one to have in Nairobi, given the resources and all of the various NGOs that are active in Nairobi, not just the international ones, but so many local NGOs, as well as one of the best schools of public health, certainly on the continent of Africa or almost anywhere, which is at the University of Nairobi. AU at that time was beginning to develop its own 3-year kind of accelerated degree program for undergraduates in public health. And so one of the requirements of that program is that students will study abroad in their second fall semester. And the department wanted the students to be going in some cohorts. They didn't want them just going anywhere on their own, but they wanted to identify, along with me, just a very small selection of programs where the students could get the courses that would count towards their major. And these would need, for the most part, to be upper level courses. So unlike most study abroad programs that offer what they call a public health course, these would have to be much more advanced than what they could get anywhere else. So we began our negotiations with the University of Nairobi School of Public Health, who don't at the moment offer their own undergraduate program in public health. It's a graduate program only. But the dean there was very keen to develop an undergraduate program. And so when we came to him with a request that they work with us and use their faculty to teach our students, he was delighted because he saw us as being his guinea pig for an undergraduate degree program. And he couldn't have been more enthusiastic and helpful. The faculty have been great, wonderful to work with. Basically, they said, you tell us what you need us to do and we'll do it. So we finalized the agreement with them in 2012 and began offering a semester-long program in public health for AU students.
And so the curriculum that our students take when they go to Nairobi provides them with 12 credits that they can apply directly to their major. They take 2 electives and then also complete an internship and take an epidemiology course. And I think partnering with the faculty who are there at this wonderful institution was actually brilliant. Our students just rave about the opportunity to study at the School of Public Health there, and the faculty have just been so accommodating. And we've had some ups and downs throughout the years with some of the curricula development, but they've really done a wonderful job of meeting the needs of our students and adapting their graduate level content to meet our undergraduate needs. So it's really been a great partnership. And we'll talk a little bit more about the internships in a second.
But I also want to say this couldn't have happened so well without Jolynn's very committed involvement in going to Nairobi to meet with the faculty and really digging into syllabi and course development. The faculty there were very desirous to meet our needs, and of course that then required that they talk faculty to faculty. Someone like me couldn't tell them what to do. And that has been one of the most rewarding aspects of the relationship, is how eager their faculty have been to work with us and make changes to the courses anytime we feel a need for that.
Absolutely. And likewise, you know, this relationship would have never gotten off the ground if we didn't have Sara's expertise as well. So we have a mutual fan club going here.
We do. Also, it's a pretty heavy-duty program because the students are doing 17 credits altogether, which is the maximum they're allowed to do at AU. We require all of our students who go to Nairobi to take Kiswahili. This is just essential. The language component is an essential part of, first, their safety within Nairobi. They can't understand what's going on around them on the street. They can't really move around freely. But also, if they're going to be interacting with the local community, they need to start learning the language and at least being able to communicate at a basic level and show their willingness to communicate at that level. Also, for any students who think they might want to work anywhere in East Africa, Kiswahili is the most widely spoken language on the continent, and so it's important that they learn it, and they can continue the study of that here at AU because we offer it here. We also added, I think in this about the second year of the program, we realized all students really needed some additional structured academic and intellectual work about where they were. And about how to make sense of where they are. So they all do a brief survey course about the history of Kenya, which is taught by our Nairobi Center director, who's an historian. who specializes in post-colonial East Africa. And then they do a course which we call Immersion in Another Culture. And that's really about their cultural integration. And that's taught by our program assistant director, who is an American woman living in Kenya, and so can identify with both sides of it and help the students make sense of their experiences and answer their questions. Next slide.
Yeah.
Oh, I'm not going.
Oh, we're trying to advance the slides here.
Yeah. Oh. What about into? Whoop. Huh. Oh, there we go.
There we go. Okay.
Yeah.
Okay.
That's me, right?
Yeah.
So the program has been incredibly successful. We've had a lot of students go through, and so we are expanding our offerings in Nairobi, which include a new track which can also serves the needs of our public health students who are in the 4-year, not the 3-year degree program. This happens in the spring, and this is also in partnership with our Department of Environmental Science. Through this, we've added some new partnerships in Kenya. One is with the School for International Training. That is a study abroad provider based in Brattleboro, Vermont, that many of you may be familiar with already. They have a program center in Kisumu in Western Kenya, and a partnership there to the CDC and KEMRI Research Center. KEMRI is the Kenyan Medical Research Institute. It's the largest such joint center that the CDC has anywhere in the world, does a lot of groundbreaking work on issues to do with malaria, with issues to do with the environment and the poisoning of Lake Victoria, and all kinds of other wonderful things. So this has given our students access to those resources. We also have a partnership with the Turkana Basin Institute in northern Kenya. This is the institute founded by Richard Leakey that does amazing research on the origins of man, on the development of the environment and human occupation. And so our students go and have a very intense course up there with the Turkana Basin Institute. And all of these new partnerships provide our students with opportunities to engage in research. So if a student wanted to do a research project in lieu of one of the program courses, they're able to do that.
So once again, we're attempting to advance the slides here. Yeah, it's not working. Okay, there we go. So as you can see, there are a lot of really wonderful opportunities for the students. These are photos of the Nairobi School of Public Health. And one of the things the students talk about really enjoying is that they actually take their classes on campus and feel that, you know, they really gain the benefit of being at this university, this premier university that offers a really wonderful public health education for them. And we, as I mentioned earlier, we have had some issues with alignment of the curriculum, but I feel like those are all worked out at this point. We also did have some a little bit of a learning curve, shall we say, in terms of our students adjusting to the instructional methods of the Kenyan professors and vice versa. But it's been such a wonderful partnership and collegial relationship that those types of things have been easily rectified. I have to say, though, that you know, it does take commitment on both the part of Sara's office as well as our faculty to make sure that we're always attending to these things. And then the last thing is we do at times have issues where some of our faculty in Nairobi have to travel because they tend to consult for the World Health Organization and other international NGOs. So we've had to adjust to that a little bit as well. But really, none of these problems has been insurmountable by any means.
This next slide just shows you a selection of some of the places where our students do internships in Kenya. The way we organize the semester is that the courses are somewhat front-loaded to the start of the semester so that they can have more time, concentrated time to engage with their internship during the second half of the semester. What you'll notice about that list, which is only a very brief partial list, is that we tend not to put our students in internships with any of the well-known international organizations. The position that we take on students engaging in their internships is that they are there to learn. This is not for them, to help the poor Africans, and it's not really for them to be an employee. They're there to learn about the issues and to see what Kenyans are doing about these issues. So we want them very much to be in Kenyan-run, Kenyan organizations, Kenyan NGOs, to learn from the people there. And of course, they are of some help. They do engage in projects. They do help with fundraising. One of the courses they can take teaches them how to write a grant proposal. So they do that. And one of the wonderful things that has come out of the program, especially because we've been there now for so long, is that we have managed to create synergies between a lot of these NGOs in ways that they would never have had the opportunity to even be in touch with each other before. But because our students share information and experiences, they've brought a lot of the Kenyans together to work on joint projects. And that's been one of the really rewarding things about it for everybody, is how the local NGOs are now in a much stronger position in many cases because of the way in which our students have helped everybody to communicate with everyone else.
And so we're not going to show you this video because we don't have time, but we just wanted to highlight that if you'd like to learn more about our Nairobi program, if you go to American University's website and search for study abroad, then you can find links to the Nairobi program, and then this video is located there. You can also go to YouTube and search for it as well.
And I'd like to say about this video, we actually hired a professional Kenyan filmmaker to embed himself with our student group for a semester. Because we didn't want one of the typical kind of student shot sort of little video things. We wanted to really get a sense of what the student experience was like and what their learning curve was like and what they gained from it. So we had this young Kenyan filmmaker be with the students for a whole semester off and on, and he just did the most wonderful job of following the students and showcasing their learning. And I really do think it's one of the best films about what study abroad can do for students that I've ever seen. I know I'm biased, but I still feel that way.
Yeah, no, and a lot of the students featured in the film are our public health students, and they have reported some of the benefits that are on this slide. They talk about the exceptional instruction they had with these amazing public health faculty. They love the opportunity that they're immersed in Kenyan culture. They do a combination of homestays as well as stays as a group in an apartment complex, and then they also have an opportunity for a rural experience, and so they rave about that. They love their internships, and just talk about that it really is an extraordinary experience. So we would like to conclude by just saying that if you have any further questions, feel free to contact either one of us at American University, Sara Dumont and Jolynn Gardner. Thank you.
Thank you.
Wonderful. Thank you so much, Sara and Jolynn. I'm definitely going to check out that video, and I'm actually going to continue on handing it over to Myriam, and we will take all questions at the end. Myriam, the floor is yours.
Thank you, Sara. Thank you, everyone. Thank you for the invitation, and the presentations that came before were great and very useful for us here at the university. So, trying to get the slide. Okay. What I'm going to talk about is a program that we developed here at the University of South Carolina with the Office of Study Abroad, a global health program in Costa Rica. In 2005, we planned 2 different visits to different providers in Costa Rica, particularly, but not only, in San Jose. So initially, I went with the director of study abroad and made those initial contacts and met different people to be able to find what type of experiences we wanted for our students. And then later on, in October the same year, I went again with other professors who wanted to participate, professors in Spanish, in social work, and I was in public health. So after all that, we created this program. Initially, we have offered this experience 2 years in a row. In 2016, you see there the classes we offer. The geography of disasters, social welfare institutions, principles of global health, and Spanish for healthcare minors, and introduction to epidemiology. Then, after doing an evaluation, we went on 2017 with 4 different classes: community health problems, principles of public health, Spanish to healthcare minors, and introduction to epidemiology, a combination of undergraduate and graduate class, each one with the respective requirements. So I am going to talk specifically about the epidemiology class. That's the class that I teach. So what we did during those visits that we conducted in 2015 is different places we went, and one of those was a nursing home. And in the meeting, we had staff, the physician, nurses, psychologists, the administration of the nursing home, and the physician said, I want your help. When she learned that I was an epidemiologist, and I said, what kind of help? And she said, I have all this data, I want to produce a report, can you help me? So I started thinking what we could do, and at the same time to be able to incorporate that experience in my class. So when I went back the second time, I went back to the nursing home and again talked to the physician and the staff to make sure I understood exactly what they wanted. So definitely they wanted us there, and I was very happy that I was able to respond to a true need of a community partner in Costa Rica. So what we did then, in my class, we had the whole introduction to epidemiology concepts, and then on that request, we created a research project for the students that was immersed in the class. So the steps that I took is, with the physician on board, we created a form that we were going to use to extract data from medical records at the nursing home. That form doesn't contain any identifying information. And then throughout the whole process, we had the physician telling us, I want this, I don't want this, and all that, and then create the database. So the abstract form has different parts: demographic information, personal history, functional evaluation, medical diagnosis, and evaluations, other type of evaluations. So here you can see the one in blue is me, and the physician is there, and I had the students there. We were building that form at that moment. We then, and I just want to show you what the form has. that's the demographic information. And I know many of you have speak Spanish, but everything was done in Spanish. The students had different levels of Spanish. Here is the history of the patients and the functional evaluation that was very important, and very quickly we had a scale that they had at the nursing home of to assess the risk for a bed sores, a scale for depression, a mini mental exam, the short and long version, ADLs, IADLs, and nutritional status. So we did all of that, and everything is pre-coded. Those of you who are data people, we had everything pre-coded, so it was easy then to enter the data once we collected it. And again, here we came back. I have the same outfit, so we didn't come back. Right there, we finished that form, and we went several times to the nursing home. So we use Epidata to create the database and extracted the information from the medical records. And with the initial group we had, we did the pilot test of the database just to make sure that the form was working, that the database we created is working, and then being able to export the data and do some analysis. Then, when we went back this year in May, we added 2 pieces to the abstract form. A more comprehensive nutritional status, including weight and height and body mass index, and a cognitive evaluation. We added that, and in the meantime, between 2016 and 17, the nursing home had students using the abstract form and entering the data, all of that being supervised by the physician at the nursing home, which we've been working with. And here, as you can see, this is 2017, May, again, the physician and myself. And as you can see, I had many more students. That was very exciting. And then, so where are we now? Currently, we have more than 100 records on the database. And I'm working with an honors college student that to conduct preliminary analysis of the data. And this is called the honors college thesis. And this student was in Costa Rica in 2016. And we are planning the 2018 experience. And I have it in here that it's the epidemiology class, but what we are doing in coordination with the study abroad and the whole School of Public Health is to make a more sound experience for the students. So we are trying to get a more comprehensive experience that goes beyond this class of epidemiology. And I wanted to share with you quickly what the students are saying. They like it. They don't think they would have had the same experience if they had been here on campus. They are learning epidemiology. And then it says it really made all the difference. The hands-on task, we go 2 to 3 times to the nursing home, and the students always say, we want to be there more. The main focus for me is for the students to know that what we are doing is in response to a request from the nursing home. They know what they want, and we are helping with the how. We are helping with our expertise, how to get where they want to go. And so if a student has this tools, how to negotiate, and how to, this is to me, public health. Thank you very much, and you can ask me questions.
Wonderful. Thank you all so very much for your presentations. I want to remind the participants that they can submit questions for any of our presenters via the question box. And we'll start taking questions now. This first question, I think is for Dr. Waggett. Are these documented? You mentioned the documented global health early or experiential learning experiences where students were engaging in inappropriate clinical activities. And this person wants to know, are these sponsored by universities, or were these activities that students found elsewhere?
That's a really good question. Most of the information that we've had has been disclosed to us by students when they talk to us about things that they've done, and they say, well, for example, we were hosting our pre-departure course and we had students show up. They had been accepted to a really terrific program to do our internship that we've arranged with partners in Moldova. And when we talked about prior experiences, one of them disclosed that she had delivered babies in the Philippines. That is one of the most common comments that we get from students and when we talk to other colleagues across other institutions. And it could be, for some students, misspeaking. They may have been in the room and they weren't actually delivering the babies. But some organizations actually facilitate, like, okay, it's time for you to step in. You're all washed up. You're wearing the coat and so forth. And the students believed that they had primary responsibility, and in some instances may have had far more responsibility than they really should have. To our knowledge, none of those have been on programs that we've run ourselves or that have been with prior providers that we have partnered with already. But we have certainly made decisions about who we partner with based on experiences that we've heard. A lot of these are organizations that have popped up in order to meet the need and the expanding need of students trying to go overseas and do work. And so unlike the American program, for example, in Kenya, or the program in Costa Rica, where the primary goal is for students to experience and listen and understand, these organizations may say, we are really trying to get you to have hands-on experience. And they recognize that some students are desiring clinical experiences, and they're making efforts to provide that. So trying to work through professional organizations to help shut some of those down, or to provide students with sufficient information to learn how, if they get themselves into a position that they weren't expecting to be in, how they can extract themselves safely, and help also provide a more ethical setting for the patients that they're working with is also really essential.
Great. Wow. Yeah, that's shocking. Definitely says a lot for the importance of pre and post experiential learning, and also preparing them properly and doing the research.
Yeah.
I think this next one is for Drs. Gardner and Dumont. You mentioned that there are a lot of different internship sites. Does the University of Nairobi or faculty members at that university help you establish these connections, or how do you go about making those?
That's a good question. We get our connections from all the people with whom we partner, and from our own staff. I mean, that's what our staff, our on-the-ground staff in Nairobi, do spend a lot of time networking within the NGO community. And you know, we've been there now doing this for 14 years, so we have a very wide network. So sometimes we hear about possible new internship sites from faculty at the university. These placements aren't made by the university, and they don't do them for their own students, but obviously the faculty who are working within communities know of them, and we hear about it from that. We hear about it just from other faculty that our people know at other universities around town, and then just from their own personal connections in their own work. We have a lot of people in Nairobi who work for our program full-time and part-time. We have a pretty good sized staff. And again, you're always making these connections and always networking. And then, you know, people at one NGO might might tell us about another or link us up with another. So it's an ever-evolving thing. When we have a student come with a new interest, I mean, for example, with environmental studies, and we had students who weren't so interested in development programs, but really in the environment, our staff went out actively to seek what kinds of organizations focused on environmental issues and found some and evaluated them. We have a whole process for evaluating the sites as well, again, to make sure that they're legal, they're on the up and up. I will say when the program first started through an alumni connection, we had some issues with a couple of NGOs that frankly were, in a word, corrupt. And initially, if they're just like a little bit corrupt, you sometimes think, well, maybe it's an interesting thing to expose students to that and they can see how that works and figure out how to deal with it. But it was really bad enough that we had to eliminate quite a few places where we had placed students in the past because we simply couldn't expose our students to the kinds of things that were going on. I will say that when you're looking to evaluate programs, I've worked in this business for a long time. There are a lot of things out there that are done by US-based organizations that are not legal in the countries in which they're operating. They're not even legal, and that's many internship programs. They're in violation of labor laws, they're in violation of visas, they're in violations of all kinds of things, let alone the ethics of what students are doing. And I don't know of any of our so-called professional organizations that will actively police that and censure that. You're on your own really to make your own evaluation, and you're just going to have to put in the legwork to do that.
Wow, that's also shocking. Thank you.
Yeah, I've been around long enough that I'm not shocked anymore, but, well, occasionally I still do. I am shocked that people don't want to grasp that nettle, but, we've spent a lot of money to make ourselves legal in Kenya. It costs a lot of money and was a number of years of working with attorneys in Kenya to make sure that everything we do is strictly legal. It's expensive to be legal abroad, and a lot of these organizations pay no attention to that. They go in as Americans and do what they want on visitor visas, and that's not legal.
Wow. Okay, thank you. I think this probably we have time for maybe one or two more questions, but I think this one is for Dr. Torres. AU mentioned that they offer language programming education in Swahili. Do your students need to be proficient in Spanish to go to Costa Rica, or is language immersion offered? And then also, since your program is is fairly new, and you mentioned expansion of the program, do you have a vision for what you'd like to see with your program going forward? So 2 questions.
The students, some of them have a level of Spanish, some of them take Spanish in Costa Rica, but since they are not working directly with patients, and I am there and the physician is there, and one of the things that I make very clear, I have to know what the students are doing at every moment. So we are at the library, we are in the boardroom, and we get the records and we bring them there, and when we leave, we bring them back. So I help them, but those students are living with host families, so they are learning Spanish, and you are not gonna believe how much they learn just living with a regular family and interacting with the locals. Now, the expansion, the vision I have is working more closely with the Ministry of Health, Caja Social Costarricense de Seguro Social, because they, as you may know, Costa Rica is one of the countries with better indicators, health indicators, sometimes better than indicators in the US. So we can learn a lot from them, and the students can learn to see what they are doing well and what we can learn to apply maybe later here in the United States. So stay tuned.
Wonderful. Thank you all so much for your presentations today. It was wonderful to learn about what you're doing at your university and college. I want to encourage all of our participants to contact the presenters directly with any questions that they have, or you can email me at webinars@asppph.org, and I'm happy to pass those along. We have recorded today's session, and I will be following up with all registrants with an email when that has posted, and you can respond to that email as well if you have additional questions. I want to note that there are additional webinars in the ASPPH webinar series that are coming up that may be of interest to you. Please check out the events page on aspph.org/events. And as a reminder, the call for abstracts is open for the 2018 Undergraduate Summit. Barring any storm this March, we hope to have it. And that link will take you directly to the Undergraduate Summit page and the link for abstracts. Thanks again. Have a wonderful rest of your day. And thank you, Dr. Torres, Dr. Waggett, Dr. Gardner, and Dr. Dumont. Have a wonderful rest of your day.
Thank you.
Thank you.
Bye.